What's up? Doc Mike. Today's topic for May 20, 2021. Dean Paul Rothman and Bill Moss talk about COVID-19 vaccines. Thank you, Johns Hopkins Medicine.
Thank you for joining us today. My name is Paul Rothman. I'm the Dean and CEO of Johns Hopkins Medicine. I'm here today to talk to Dr. William Moss, who's a longtime expert on vaccines. He has spent his career focused on vaccines, not only on the science, but how to deliver them effectively and equitably. Bill is the executive director of the International Vaccine Access Center and a professor at both the Johns Hopkins School of Public Health and the School of Medicine. Today, we're going to be talking about COVID vaccines and how the vaccination process is going both nationally and internationally. It's a complicated topic, one that I know Bill has thought a great deal about. Thank you for joining us today, Bill.
Thank you very much for having me, Dean Rothman.
Tell us a little bit about the people who are not presently vaccinating, and I'm thinking about two populations, one of which is children, and the other one is who we are vaccinating, but there's some question about it, which is pregnant women and also women of childbearing age. Could you talk about those two groups that I'm sure people are really interested in?
Yes, these are really important groups, and they were not those two groups, children younger than 16 or 18 years of age and pregnant women, were deliberately excluded from the large phase 3 trials that led to the emergency use authorization by the Food and Drug Administration. For children, this is a very typical process. This is how the process works. We start our evaluation of any new vaccine in adults, and then what we call age de-escalation, study the vaccines in younger and younger children. And when we get to the younger children, the youngest children, I'll say, we need to look at the dosing again, because the vaccine dose that we use in adults or even older children may not be ideal for the youngest children. So the way this process is working, and great progress has been made with the Pfizer, Moderna, and Johnson & Johnson vaccines in advancing this, is that the next group of children in whom we expect to see results are those children 12 to 16 years of age for the Pfizer vaccine, 12 to 18 years of age for the Moderna vaccine. And I expect that we're going to see an emergency use authorization probably in the coming months. I certainly before the end of the summer and before the next academic year. Pfizer has already released some of their preliminary data in a press report. Then what's happened now is that the clinical trials in younger children, 6 years to 11 years of age, 2 years to 6 years of age, those studies are ongoing now, but I don't anticipate that we're going to get emergency use authorizations probably until early next year, early 2022, for those younger age groups. Now, with regard to pregnant women, this is a very important a special population for vaccinations. We know, and there's increasing evidence, that COVID-19 is a severe disease in pregnant women. They have 3 times the risk of developing severe disease, maybe 5 times the risk of ending up in an intensive care unit. We see this with other infectious diseases, the increased severity among pregnant women. So this is a very important population to protect. Now, again, pregnant women were not deliberately enrolled in the phase 3 trials, but over time, we've accumulated a lot of experience in COVID-19 vaccination of pregnant women. More than 35,000 pregnant women have been reported through the Vaccine Adverse Event Reporting System to the CDC. Looks like they may have some more soreness at the site of injection, but maybe even decreased systemic signs and symptoms. Very importantly, there's another another mechanism that the Centers for Disease Control and Prevention has established for monitoring vaccine outcomes among pregnant women and their offspring. The CDC recently presented preliminary data on this. About 4,000 pregnant women were included in this evaluation, and very importantly, it does not appear that there are any serious adverse events occurring among pregnant women who've received the vaccines.
Give me a little bit about what you're looking over the next 6 to 12 months will happen.
Yeah. So, I don't think that we're going to reach some magical point where all of a sudden we're going to go back to our pre-pandemic lives. This is going to be a process, a phased process in which we slowly return to, more normal lives as more and more people get vaccinated, and hopefully in the United States as community transmission goes down. If we can get particularly the vulnerable, but really as much of our population vaccinated as possible, and we start seeing community transmission go down, we're going to be able to slowly return to normal. And we're going to see reductions in the restrictions, first for outdoor gatherings and then slowly for indoor gatherings. I think contact tracing, quarantine and isolation are going to be kind of our end game strategy. As you know, we're still going to see kind of pockets of transmission, and we're going to need to shut those down. Now, the issue of booster doses and variants is a very important one. Fortunately, thus far, the evidence suggests that our current vaccines are protective, particularly against severe disease, against the variants that we've seen now. The variant that was first identified in the United Kingdom, the variant that was first identified in South Africa. Our vaccines seem to be protective against those. Maybe some loss of efficacy or lower neutralizing antibody titers as measured in a laboratory, but still they seem to be protective against severe disease. But this is of concern. And what we need to do very rigorously is monitor hospitalization, I think particularly hospitalizations and deaths. What proportion of people being hospitalized and dying have been fully vaccinated? Because for me, that's going to be the real red flag. If we start seeing hospitalizations and deaths in people who were fully vaccinated, then we need to be concerned.
Some people have talked, as you think about trying to get vaccines to around the world, that perhaps for J&J is a single dose, so that one's easy, but the Moderna and Pfizer and AstraZeneca are all two-dose vaccines. What do you think of this idea about only giving one dose of those vaccines to people? Is that a reasonable idea?
So there's been a really vigorous debate about the use of a single dose, the way I would frame it is delaying the second dose. And there was a rigorous debate here in the United States about this, with experts on both sides of that debate. So this is certainly a question where experts can disagree. On the one hand are perhaps the purists who will say, and Dr. Anthony Fauci has been on this side, the trials were with two doses. That's what the science guides us on. And there's at least a theoretical concern that if people get a single dose, there may be some partial immunity that may allow escape mutants to evolve more readily. So there are very smart expert people on the side that we should follow what the phase 3 trials told us, and that's around 2 doses, and that we should not be delaying that second dose. Although I will say that the timing of those that second doses was really done for convenience. The 3 weeks for Pfizer, 4 weeks for Moderna. That was in part to get us through the phase 3 trials as quickly as possible, so that we, in the midst of a terrible pandemic. Now, there are many other experts on the other side who say that we would be much better off from a public health point of view getting a single dose into as many people as possible. We now have, increasing evidence that there is protection conferred by a single dose. We're still learning the duration of that protection, but we're still learning the duration of protection of 2 doses. So in this debate with experts on both sides, I actually favor delaying that second dose and getting more doses into individuals, seeing if we can reduce transmission, and again, particularly reducing hospitalizations and deaths.
Bill, I learned a ton today. I so appreciate you taking the time to talk with us and all the work you've done during this whole pandemic. Bill and I get to be on Zooms together, and Bill has been really helpful for a variety of folks to inform them and to provide your expertise to people both here and around the world. So Bill, on behalf of Hopkins, thank you for what you've been doing during the pandemic, and thank you so much for talking to us today.
Thank you very much, Dean Rothman. It was my great pleasure to speak with you.
Thank you all for watching, and be safe and stay healthy.